Good morning, everybody. Welcome to this Friday's webinar presentations. We've got two talks lined up this morning. Dr. Chen will be talking to us about Nigeria, and James Earlham is going to be talking to us about education for sustainable health care. James, I believe you may have another meeting at 8. Are you happy to go first, or would you like Jonathan to go first from our end?
I do have another meeting at 8. Good morning, everyone.
Morning.
So
I think you can
I'm
probably
happy to
start off
present
then.
whenever, as long as I can leave by 8.
All right, great. So we're going to start off this morning. Thank you, James, for joining us with James Earlham, who is a senior lecturer in epidemiology and education for healthcare. He's also the chair for the Education for Sustainable Healthcare unit. And yeah, we're quite excited to hear your talk this morning, James. Thank you for sharing. I'm going to mute from our side.
Thank you very much. Well, you can see me and hear me all right, I guess?
Yes,
okay.
Audio and visuals, great, thanks.
I don't need my visual, so let me just turn that off. And again, just thank you for this opportunity. Sorry, I'm just trying to stop my video. There we are. So thank you. I am within the Department of Family, Community and Emergency Care. And this is work that I did towards my PhD on education for sustainable healthcare. And in this presentation, I'm just going to take you through what some of the implications for curriculum might be, and then also for surgical practice. And I'll begin with just a definition of education for sustainable healthcare. This is a growing field within health professions education that seeks to develop the necessary knowledge and skills and attitudes about the interdependence of human health and planetary health. So planetary health being the health of the ecosystems, planetary systems that are foundational for health and healthcare. And it's arisen because of the growing impacts of climate and environmental changes on health. We see that with the news of extreme weather events and droughts and heat waves and fires, as well as the long-term, less direct impacts on mental health, malnutrition, for example. We also know that healthcare has a huge environmental footprint. And this is what this report addressed in 2019. This is from an organization called Healthcare Without Harm, which was established some time ago in recognition of the enormous carbon footprint of the energy, water, waste, transport, pharmaceuticals, etc. And they've done a calculation that the climate footprint of healthcare is equivalent to about 4.5% of global net emissions. So that might not sound like a lot, but if the healthcare sector were a country, it would be the 5th largest emitter on the planet. And so that those greenhouse gas emissions are what are warming the planet and causing the extreme weather events and ultimately the degradation of planetary ecosystems. And so the report concludes that we need action in those 6 areas. I've highlighted the ones that relate to the healthcare sector specifically, and the methodologies have now been developed to measure the emissions from the healthcare sector and to make sure that the governments are held accountable. You can see from the map there that the USA is the largest emitter, but there is no data from Africa, or what data there is of very poor quality. And so that is the first challenge, is to be able to measure what you want to manage. And so South Africa, along with many countries around the world, are starting to look at ways of measuring the emissions of their healthcare sector. This is a publication specifically for health professionals in South Africa, Suffocating Under Fossil Fuels, and it unpacks what climate change means for health professionals in the individual capacity and the capacity as healthcare providers within healthcare systems. Again, it is co-sponsored by the Global Green and Healthy Hospitals Network, a project of Healthcare Without Harm, and which has been active in South Africa to promote climate smart healthcare. Here is the agenda of the Global Green and Healthy Hospitals. So you can see there the 10 goals relating to firstly leadership, and then the particular impact of chemicals, waste, energy, water, transport, food, pharmaceuticals, buildings, and purchasing. And this agenda was adopted by Groote Schuur Hospital in 2014, and they set the target then to become the first polystyrene-free hospital in South Africa. And it has had variable success since then. It's sort of had its champions and then times when it hasn't been fully championed. There are a number of other hospitals locally in the network, Mitchells Plain and Victoria and Red Cross, all of which are committed to this sustainability agenda. And case studies are shared which enable people to really understand not only the environmental benefits, but also the economic benefits, and often better quality healthcare informed by evidence. So how can the surgical professions respond in practice? So I'm just going to take you through these 4 main points. That reducing the carbon footprint, we know that surgical procedures have a substantial carbon footprint due to the energy-intensive nature of operating rooms and anesthesia gases and surgical instruments and all the disposables. And so surgeons can contribute to reducing this by adopting practices that prioritize energy efficiency, waste reduction, and sustainable procurement. And that means working together with the health departments and those involved in the whole procurement chain, which we know isn't an easy thing. Secondly is to minimize waste. So surgeons can promote waste minimization by using reusable instruments when feasible, implementing recycling programs in operating rooms, and adopting techniques that reduce surgical waste generation. And obviously just being part of efforts for primary prevention. So trying to prevent people entering the surgery and the ICU in the first place. And so that obviously has implications for the upstream determinants of health and the conditions that bring patients into surgery. Thirdly, promoting minimally invasive techniques. So these generally require less energy and produce fewer emissions and result in shorter hospital stays compared to traditional open surgery. And so again, surgeons can do their part to promote the adoption of these techniques wherever appropriate. And then fourthly, advocating for sustainable healthcare practices. So the kind of green hospital agenda has been driven by hospital administrators, by medical professionals. It has, in our Western Cape government, driven the move towards a more sustainable healthcare service. But we know that budget cuts do make it difficult. And also the idea that, well, this perhaps isn't my job as a health professional. You know, I'm saving lives. I don't have time or energy to put into the broader advocacy. So it's confronting that kind of moral offset mindset that is needed, and for people to understand that when we look at interventions to improve the climate emissions, they also have health benefits. And so this is from the Lancet report, a recent Lancet report, which shows on the left there interventions that have benefits both for health and for reducing greenhouse gas emissions. And the key ones are advocating for a energy transition away from our very fossil fuel intensive one, particularly here in South Africa, to renewable energy, which have not only immediate climate, not only have long-term climate impacts, but also immediate air pollution mitigation impacts on local communities. And then just becoming more energy efficient in homes, in hospitals, looking at our transport system. We unfortunately don't have a very energy efficient transport system or functional public transport system. And so promoting active travel and public transport means that you're going to also promote people's physical and mental health, and again, the air quality of urban environments. The same applies to solid fuels used for cooking, so reducing those reduces the ambient air pollution and the indoor air pollution, again with co-benefits for respiratory and cardiovascular health. Less red meat in diets, increased fruit and vegetables, so the so-called Planet Healthy diet is something that's gained popularity, and the evidence for that is being amassed. Again, the Lancet had a special commission looking at what would be the planetary health impact of people shifting to plant-based diets. So all of that implies that we need systems thinking. We need to educate our students, our clinicians, to think about the systems that underlie their lifestyle choices and the choices that are made in healthcare. And so that brings me to education for sustainable healthcare, which is a particular passion of mine. It's a key component of national commitments to low carbon and climate resilient healthcare systems, recognized by the World Health Organization and their civil society working group to advance action on health and climate change. And they've called on health education stakeholders to incorporate climate change into curricula and to prepare health professionals to ensure that our healthcare systems can function in a climate change future. And there are many examples of that, which I will show just now. So for now, just an overview of the mixed methods study that I undertook. It was in 3 phases. So informed by the International Consensus Statement on Education for Sustainable Healthcare, I performed a national audit of health professions education curricula in faculties in South Africa, recruited a national Delphi panel to assess the applicability of the learning objectives and activities and assessments proposed by the AME consensus, and then looked at our own Faculty of Health Sciences here at UCT using a tool called the Planetary Health Report Card. So this is an international student-led initiative. It started in the US in 2019, and students in all the faculties, and there are over 100 now that have completed it annually or biannually. Students have taken the lead. And so I recruited some medical students to interview colleagues, review documents, and to complete scorecards on how we are doing with respect to 5 areas, namely our curricula, our research, our community outreach, student leadership, and campus sustainability. And you can see that overall, we scored only a C, that was less than 50%, and none of the categories show that we really up there, but this is a baseline. That's pretty much what we expected, and it provides a baseline for future iterations, and we're planning one again for next year. So what were some of the recommendations? from colleagues in the preclinical years and in surgery and medicine. They called for sustainability to be a cross-cutting theme across all years, including indigenous perspectives on health, making sure that we have planetary health and sustainable healthcare in our foundational years and in our problem-based learning cases. And then also educating and advocating for sustainable clinical practice among clinical educators and students. So obviously, your educators are the ones who are teaching students, and we need to work on improving sustainable practice in those clinical teaching environments. There are a number of barriers that we found that are common with the international literature. So chief amongst them being curriculum overload. So there's too many subjects. How can we work across silos to try and integrate this content, given that this kind of interdisciplinary approach is essential for dealing with these challenges to planetary health? How can we counter the biomedical bias that often dismisses or underplays the environmental determinants of health and environmental health content? And then clinicians also spoke of how an ethic of sustainability may conflict with one's duty of care to the individual patient, and also how the need to cut costs and to deal with urgent challenges in the health system tend to marginalize concerns about environmental sustainability. So these are some of the challenges. The thesis proposes an integrated curricular development framework for education for sustainable healthcare. So you see there 6 steps, beginning with eco-ethical leadership. So leadership that helps to conceptualize what does a student from our, or a graduate from our faculty look like, who has a planetary health awareness and the skills to promote sustainable healthcare. Developing educator capacity, so the ones who are teaching our students, what kind of skill set do we need for educators? Identifying opportunities for education for sustainable healthcare in the curricula, so current opportunities like the social and environmental determinants of health or sustainable development goals, and then testing innovations around education for sustainable healthcare. So here, for example, we're looking at the special study module, a selective component of the 3rd year medical curriculum, and also the elective program in the 5th and 6th year to offer opportunities in sustainable healthcare and planetary health. And then integrating these themes and topics into the curriculum. So once you've tested and evaluating them, how can you integrate them longitudinally? So make sure that you do indeed have a spiral curriculum that begins with foundational years and develops that knowledge and awareness throughout the course of the curriculum. And here I'm talking not only medical, but our health and rehabilitation sciences programs as well. And then the final step is in ongoing collaboration and development and evaluation, working in partnership with the healthcare sector and partnership with students and educators, and making sure that it is a multidisciplinary approach. So that is the overall framework. So worldwide, faculties are integrating ESH into their curricula by existing courses or dedicated courses, again with this interdisciplinary approach, providing climate health scenarios and research opportunities, and emphasizing the role of health professionals who have a lot of agency in advocating for climate and health mitigation. Agency because they are close to both the causes and impacts of climate change, and are generally respected members of society who are able to exercise that voice in the individual in the institutional and in the public health arenas. So the implications for surgical education and training then would be to look at how the curricula can include content on environmental sustainability and is relevant to surgical practice. So this may involve teaching students about the environmental impacts of healthcare, as I've just outlined, strategies for reducing carbon emissions and waste in surgical settings, training in green surgical practices. So again, the minimally invasive surgery and energy efficient operating room management and waste reduction strategies. Interdisciplinary collaboration, so thinking beyond just the health professions to professionals in fields such as environmental science and public health and engineering and policy, which are all part of what is needed to effect those societal changes that were illustrated in the infographic I showed from the Lancet report. And then finally, professional development in advocacy and leadership, which would include communication skills, strategic planning, training in policy advocacy for sustainable healthcare at local and national and global levels. And the good news is that there are lots of resources and predecessors in this space. So here, for example, is a huge education resource database from a group called the Planetary Health Alliance, which catalogs a growing number of resources around the world. And as we undergo curriculum change in our faculty, we're looking at this Planetary Health Education Framework, which has 5 domains represented in the figure. Interconnection with nature, movement building and systems change, the Anthropocene and health, equity and social justice, and systems thinking and capacity. And so the idea is that each of these could form a longitudinal theme through our curricula, and the link to those would be topics in the different courses that ultimately would speak to our local socioeconomic, cultural, and environmental determinants of health and the global agenda for decarbonizing healthcare. I can also share other resources that have been developed that bring it down to the operational level. So, for example, this publication from Australia and New Zealand looks at what needs to be done within the ICU. So it's a sustainability toolkit that collates ideas and actions based on international evidence. And then this is looking particularly at environmental sustainability in anesthesia and critical care, and the role of environmental life cycle assessments, which analyze a cradle-to-grave environmental footprint associated with the extraction, manufacturing, packaging, and transport and recycling of products or processes. So again, taking that systems approach and seeing where are the leverage points within that system to effect a major change. Okay, so I think my time is up. There are some further references that can be shared, but I'm sure there are some questions, and I'm happy to take those. Thank you.
Morning, James. Thank you very much for your talk, and I'd just like to congratulate you on all your work that you've been doing. I think it's quite essential that this becomes part of the medical student and sort of allied healthcare professionals curriculum, because a lot of us aren't aware of ways to reduce our carbon footprint. For us that spend a lot of time in theatre, do you have any, I mean, you put up one of the resources there at the end on how to reduce or go a bit more green theatre. I mean, I read you can, if you do a hand wash properly, it's about 18 liters per case per person that you sort of waste. So they do say that sort of alcohol-based washes are equivalent to soap and water. I know we still use a lot of disposable equipment, even though, I mean, using gas equipment is as efficient and not doesn't carry higher risk. But are there any other any other advice that you could give us for in theatre wise, how we can, because I mean it's for us to go back to the basics. We don't have that third year curriculum yet, but where we are right now, any advice that we can incorporate into our daily sort of practice?
Yeah, you know, I'm not a surgeon, so my perspective is really from the environmental health. So again, coming back to the Green Hospital agenda, it's about looking at the systems approaches. So firstly, the sustainability in the ICU publication makes clear that industrializing prevention, like reducing rates of smoking and alcohol and diabetes and obesity and better trauma care, you know, those upstream determinants would obviously make a major impact on the need for ICU in the first place. Also working with the Department of Health on its procurement. So looking at the increasing options that are available for procuring greener products. Now, I know the challenge there, and my colleague John Lazarus can bear me out, is that often cost is the major determinant, and so the environmental friendly product might be the more expensive one. So I think having surgical health professionals speaking out and saying this is important and what can be done to improve the procurement to make it more environmentally friendly will have an impact. We do have a Western Cape Department of Health that is very aware of these green hospital issues. They are doing some significant work, but much more needs to be done and within the constraints of budget. And then I think, again, the systems approach of how do we educate our next generation of students to think about life cycle assessments and, you know, the environmental impact of what is happening in the operating theatre. I am not sort of qualified to comment more on the sort of technicalities of, you know, the equipment, except to say that there are experts who can advise on that. Dr. Shrikant Peters, I'm not sure if he's on this call, but he has experience in teaching sustainability in healthcare, and he offers electives on quality improvement and sustainable quality improvement. And so he would be a good resource.
Thank you, Judge. Professor Kestner just has a comment. Thank you, Lisa.
Hi, James. Morning.
Good morning.
It's great to see that people are filling this space. I think just something that we've learned in our department, looking at the reusing of single-use devices, is that people will not change and things will not change unless it is forced. And especially when it comes to an environmental concern, I think across the board, when there's a kind of a strike between profits and business. And I think that is the problem when it comes to our industry, is that a lot of the decisions that are made are policy decisions that are informed by industry. And when one goes to kind of big meetings, you see an absolute explosion of the development of single-use everything, single-use scope, single-use. And I think that unless there is a collective kind of a legislative pressure to promote the production of reusable things and to discourage the kind of the marketing and flooding of the market with single-use items like scopes, to replace reusable things, I don't think that things will change for us. And although I think one does appreciate the need to treat students, which we really need to do. I think those of us that train in the resource limited setting, I think we're almost used to turning over every brown penny, like using a linen saver 52 times because there's none left in the box. So we, by a resource constraint, are forced to think that way. But when it comes to reusing things, and we're literally legislatively not permitted and are actually threatened with a disciplinary action if we reuse things which are denoted by a company as single use, which we know we can use 50 to 60 times because we did it before. Our employer told us, if you do it again, you're going to be disciplined. And we also know that in Africa, where there's no money, these devices are used multiple times. I really do believe that the change needs to come from the top and filter down, because it's that is our experience. And I think John can talk even further to this, because I think he bore the brunt of quite some aggressive management of his aggressive recycling strategies.
Thank you. Yes. So John can relate the story of, trying to get the South African Health Products Regulatory Authority to change its guidelines for reusable, and well, he can speak better. I've been part of some letters that have been open letters in the SAMJ, and finding evidence from healthcare systems around the world for the safe reuse. The imperative towards low carbon healthcare has definitely increased interest in reuse rather than single use. But yeah, the Health Products Regulatory Authority has powerful industry players on its side, and yeah, it is frustrating when they take so long to respond. But John, if you're here, you can say more about that. Is John on the call? I'm not sure.
No, I think Professor Lazarus is is away on an outreach in George, so he might be operating at this point in time.
Okay. Yeah, so he sort of kept me abreast of the SAHPRA response, and I think the last one several months ago was that they were consulting with their
we're just starting to do a bit here, James. I don't know if I think it's on our side. Our signal is a bit.
Can you hear me all right?
This morning, so we're missing a little bit of what you are.
Okay.
Yeah.
Can you hear me okay if I'm speaking now?
Yeah, we can hear you.
Okay.
Perfect. Thank you.
Yeah, no, I was just saying that John has been updating me on the SAHPRA response. It's been years now, and most recently their response was that they were consulting with their stakeholders. So we're not sure to what extent they're being informed by industry interest rather than evidence. We have offered to do a presentation of the evidence, and reuse is certainly essential if one's going to reach the kind of net zero emissions targets that healthcare systems around the world are aiming for. There's also a guidance document that I can share, the business case for greening the operating theatre. So that is from Practice Green Health. That's got a lot of case studies. And then I can also share case studies. So those are American case studies. And then I can also share case studies from the Global Green Healthy Hospitals network in South Africa that, show the rands and cents of what these kind of greening initiatives can save in the long term. So I think having that evidence both internationally and locally, and making the economic case as well as the environmental case is the way to go. Not to say it's ever easy, but one has to be informed by the evidence of what is happening around the world.
All right. Thank you very much, James, for your time and effort that you put into your talk this morning, and for starting this initiative, which we're probably years behind where we
should be, but you've gotten it going quite exceptionally well so far. So thank you for all of that.
Thank you.
We hope to touch base with you again for future talk, and we can hopefully give you some positive feedback on our end on how things are going from a theatre, from a clinic. Hopefully we are considering applicable patients to do sort of telephonic consults instead of regular OPD. So, I mean, that's obviously going to save on petrol emission and all of that. So there are lots of different ways we can combat this thing. And I think it's going to require a lot of teamwork from lots of different ends. But thank you once again, James. We really appreciate your time this morning, and we'll chat to you soon. Thanks.
Okay, you're welcome. All the best. Thank you.
Thanks. All right, we're going to move on to our next talk this morning from Dr. Jonathan Chen, who's going to be talking to us about nocturia. Thank you, Jonathan.